Good afternoon, everyone. Thank you all so much for joining us today. We're really excited about this particular collaborative live stream, all on healthy homes, staying safe around lead. If you've not seen one of our programs before, my name is Alex. I'm a public health educator with the Washington Poison Center, but I'm not nearly as exciting as our guests today, the folks joining us. So this is a combo approach between the Washington Poison Center and the Hazardous Waste Management Program. So from that program, we've got Sharon and Matt, who are both fabulous health and environmental investigators. We've also got Julia, who's a program director with that program. And we've got Stephanie, who is a pharmacist with the Washington Poison Center. So the amount of expertise on this stream is just insane, folks. All right, so we're here to talk about lead. And not just what lead poisoning is, we're going to get into that, but we're going to talk about how to protect yourself and your family from lead poisoning. So a bit of housekeeping on this stream. If all the connections are working properly, feel free to ask any questions in the comment sections on the Facebook event. We should, knock on wood, we should be able to see that, and we should be able to answer those questions as they pop up. Worst case scenario, if we don't see it, we'll do our best to follow up in the comment thread after. So please engage with that comment section and we'll answer what we can. So before we dive in, Matt, would you mind telling us what is the Hazardous Waste Management Program?
Sure, Alex, I would love to. So the Hazardous Waste Management Program is a partnership of 5 local governments, one being Public Health Seattle-King County, that's where both myself and Sharon are housed. Also, the county's Water and Land Resources Division, that's where Julia is from. We're also partnered with the county's Solid Waste Division, Seattle Public Utilities, and the Sound Cities Association. And we all have a vision of creating a county that is healthy, thriving, and free from hazardous chemical exposures. And we aim to do that through collection services, prevention measures and education, and also policy.
Fantastic. Thank you so much for going over that. All right, so Matt and Sharon, let's kick us off. Why should we care about lead exposure?
Sure thing. I'll kick us off with that. So lead is a common naturally occurring metal that humans have found useful for thousands of years. And because of this usefulness, we could actually find it often in all of our environments. But unlike other metals like iron or magnesium, lead has no purpose in our bodies. It's actually poisonous, and there's no safe level of that lead that should be going into our bodies whatsoever. While rules and regulations have aimed at prohibiting lead in common products like gas and paint have helped reduce lead exposure and thus lead poisoning, it's still very much common that we come across. And so when it comes to the actual health impacts of what lead can do to you, I'll actually pass it over to Sharon, who can kind of go into more detail.
Okay, thank you, Matt. So everyone, children, infants, those in utero, and adults can potentially have lead poisoning. Lead does affect every single organ system in the body, and those who are most at risk are children 6 years and younger because their growing bodies absorb so much more lead than adults, and their nervous system and their brains are still developing. So in children, what are some of the health effects of lead? Well, it can have learning issues, learning problems, behavior problems. They can become very impulsive and unable to control their behavior. It can lower their IQ, which makes it much harder to do well in school. They can also have hearing problems. And it can also cause slowed growth and anemia in children. Lead in adults, including pregnant women, have some different symptoms. It can cause hypertension, increased blood pressure, can affect the kidneys, and pregnant moms do pass it along to their unborn children. In rare cases, if the lead poisoning is extremely high, it could cause seizures, coma, and even death. So I have been out to see so many kids and so many families doing lead visits that I'll just give an example of one of the families that I did see. And oh, before I do that, though, excuse me, I am going to say that paint chips and lead-containing dust are the most common sources of lead exposure for children in the United States. And in the US, there's approximately 24 million housing units that have significant lead-based paint hazards in them, including deteriorated paint and lead-contaminated house dust. So about 4 million of these homes have young children in them. And in King County, we've determined that approximately half of the homes were built before 1978 and have the potential to have lead-based paint in them. So when the exposure comes from the lead paint and the lead dust, when the lead-based paint is deteriorated, worn, cracking, and any surface that contains lead-based paint where there's friction, say if you open a door, close a door, open a window, close a door, say a chair might rub up against the wall, that will cause the paint to wear down. Also stairways, cabinets, when you open and close the drawers, all that could cause lead-based paint dust. So children can be poisoned, say if they chew on the surfaces, such as windowsills, door ledges, or if they see flaking pieces of paint they might put in their mouths. And I am told, although I've never tried, is that lead-based paint tastes very sweet, and that can be one of the attractions for them. So going back to this story of a family that I visited, child had elevated blood lead levels. The family lived in a very, very old home, about 100 years old, had exquisite lead-stained, glass-stained windows in them. The exterior of the house was in very poor condition. Peeling, chipping paint, chips on the ground. Dad had attempted to do some other repair himself, but it stopped after a certain point. And when I walked around the backyard, there were chunks of lead-based paint all over the ground and right under the drip line of the house. And the child was playing in the dirt there and eating these paint chips. And then when they came up the stairs to one of the 3 entrances to the house, there was lead dust inside on the landing, and the family did not take their shoes off at all when they walked into the house. So my advice to the family was to hire a certified renovation, repair, and painting contractor to complete the work, or if Dad were to do it, I sent him quite a bit of information on how to safely protect his family while he did it. The entire family removed their shoes once they went inside, and Mom damp dusted and damp mopped at least once a week. So after following this child in our database, the child's blood lead levels had come down to near 0 after a few years. Now, Matt, I think I will pass it on to you. Or no, I am sorry, to Stephanie.
All right, thank you so much for that. I am sufficiently alarmed by dust and paint chips now, so thank you for providing that walkthrough and discussing how everyone is potentially vulnerable to lead poisoning. So we're going to temporarily shift gears and provide a poison center perspective on lead here. But before we do that, Stephanie, do you mind describing what your role with the Poison Center is and what the Poison Helpline is?
Absolutely. So I'm a pharmacist with an additional 2 years of training in toxicology. I'm one of the people that whenever you dial the number, the 1-800-222-1222, I'm the one answering the phone for whatever question you may have. For the Washington Poison Center, we're a nonprofit organization that's a free 24-hour call line that's answered by pharmacists and nurses with expert training in toxicology. And it doesn't have to be an emergency for someone to call. We also can provide medical information and medication guidance as well, in addition to the toxicology and poison center focus.
Wonderful. Thank you so much for that. Now, what does the Poison Center hear about lead?
So fortunately, most of our lead calls are kind of false alarms. They're people calling because they know lead is an issue, but they're uncertain if they've been exposed to lead. I think the most common one's probably pencil graphite. That's, we call pencil lead, but typically is not lead based. It's graphite, which is fairly harmless. So those are a lot of the calls, which we would much rather have people call and not need us than to hesitate to call whenever they actually did need assistance with something. So we can help guide people on which situation they fall in. Most of the common lead cases out there, like the paint chips that were described, we don't get a lot of calls on that per se, because the pediatricians are well versed and there's clear guidelines on how to manage those things. But we're available should there be questions that come up regarding those situations. What we do hear about is kind of the off-the-wall unique situations where maybe a child was playing in a tackle box, fishing with family out on a lake, and swallows the lead weight that's inside of it. Or a family had been hunting and had used a shotgun and were eating their hunt and found there's actually pellets in there. And a 2 or 3 year old child may not realize what they're eating and wouldn't even bring it up to your attention necessarily. So those are the unique situations we see. And those are mainly children, but when you get into adults, it gets even a little bit more obscure. A lot of them are occupational based. Also, there was one time where a gentleman had a glass decanter that he had been storing his fancy liquor in. And whenever he put the glass object through TSA at the airport, he realized, oh, it's not just glass, it's lead-based glass that he had been using for years. So those are some of the unique situations we find ourselves in, and the Poison Center can absolutely help out, whether you just want to find out if what you have could be an issue and what steps to take next.
Wonderful, thank you. So then I will we'll round out the Poison Center portion of this by asking, what are your top tips for preventing these kind of cases?
So knowledge is the biggest factor, just knowing that lead could be an issue and what resources you have to find out more information. Of course, safe storage is always a big factor, particularly when it comes to pediatric exposures. So locking things away, storing them in high shelves in places where children wouldn't normally access is going to be the biggest deterrent to keeping people safe from those typical lead exposures.
All right, thank you so much for that, Stephanie. Okay, we're going to switch back to some of our hazardous waste folks. Let's see. We talked about how concerning lead-based paint can be. How can you find out if you might have lead paint in your home, and what do you do? I heard you say something about the year 1978.
Right. As Sharon had mentioned earlier, homes constructed before 1978 have the potential of containing lead-based paint. It was at that year that the EPA had banned lead-based paint's use in residential settings. And so as you move older or years back from 1978, there is a higher chance that it may exist in your home. And so in order to determine that, as most of us aren't aware of like when our homes might have been constructed, you could use your web browser, whether it's Safari, Google, Firefox, what have you, and simply type in King County Parcel Viewer here, and you'll find this first hit, it'll be that top link, or more than likely it will. And then once you click onto there, you'll be put onto this page, and already highlighted for you, you'll see that you can start the parcel viewer. And so what this is going to do is be able to get you onto this map, which actually has all properties parceled out. And using this search box right here in the upper left corner, you could input your home address. And so for an example, I put in our public health building's address here in downtown Seattle, the Chinook building. And right at property report, you'll find this hyperlink. If you click onto that, you'll actually get into further detail of that property. And right here at the top of the building description, you can find year built. So our Chinook office was constructed in 2006. So that's where families or individuals can go to search up their construction year or year built and determine if lead-based paint may be a potential hazard.
Excellent. Thank you for that walkthrough. We'll try to put that link in the comment section for folks to see. All right, so let's see, where are we at? I think we're on to Julie. So Julie gets to do some fantastic demonstrations for us today. Julie, excuse me. How, I keep calling you Julie, you're Julia. I had a typo on the thing there. Apologies for that. How do you safely clean your home if you suspect you may have lead paint or lead dust?
Well, thank you, Alex. And yes, we do want to talk about safer cleaning. So if your home was built before 1978, as Matt said, and Sharon did mention that we believe that about half the homes in King County were built before 1978, then we suggest you do something called damp dusting and damp mopping, as opposed to dry cleaning, which would be vacuuming or using a feather duster. So today what I want to do is show you, it's very simple how to do that, and hopefully we can run I have a flyer that we can see that we can put into the chat box so that people can click on that so they can see the directions. But I'm going to show you how to do damp dusting and damp mopping. And the way I'm going to do that, I'm going to flip my phone. And so here you see in front of you everything that you need. Oh, I could do it that way. Yeah, for damp dusting and damp mopping. It's pretty simple. You have a bucket with some water in it, and I'm using for my damp dusting, I'm using a microfiber cloth. And the reason we recommend that cloth is because microfibers are made with a bunch of tiny hooks, so they're really good at reaching out and grabbing onto dust and dirt. And the way that you want to prepare your solution is you have a bucket of water and then some dish soap. And although most dish soap is safe to use, if you want to find the absolute safest dish soap that can be found, we would suggest using a product that has the EPA, Environmental Protection Agency, Safer Choice logo on there. That's the middle logo. And what that means is the EPA has certified it to be the safest in its class for human health, environmental health, pet health, and also they have tested it to see that it actually works. So this has been tested to see that it does work. So I'll put a couple of drops into my bucket of water, use my microfiber cloth, get it wet. And then one of the other keys for cleaning or damp dusting is to start with the highest surface first. And we'll start with a horizontal surface. So since this is high on my door, I would do this surface first, potentially get some dust. And then as Sharon mentioned, a concern if you have older paint is a friction area where if you have a window that goes up and down. So this dust that is on my window ledge may, if I have lead paint, contain some lead dust. So I want to wipe this with my cloth. And then going down, because I said is that a cleaning principle as you go from high to low in your home, the next lowest horizontal surface is my baseboard. I'll go ahead and wipe that with my microfiber. And then I would come back over to my bucket of water, swish and clean. And I would probably use that bucket of water to clean the living room. But now I do want to show about damp mopping. And again, I'm using a microfiber cloth, but what's special about microfiber mop, what's special about this mop is that the head can be removed and washed in the dishwasher. So getting it wet, trying to wipe off a little bit of the excess water. And then, as Sharon mentioned, an area of concern could be a doorway where you have a friction point. So I would want to make sure to get in there and get that dust. And then just here I am, damp mopping. And that's how you do it. I'm sure everybody knows how to mop instead of vacuuming. One other thing that we suggest is with your dirty bucket of water, that rather than potentially pour it out even in a utility sink, we suggest pouring it out in the toilet for a better disposal and less exposure of your family to potentially harmful lead dust. And that's how you do it, Alex. So back to you.
Excellent. Thank you so much for that, Julia. I love the action shot. Next time we got to get the camera right on the mop so we can really see. All right, so Sharon, welcome back.
Thank you.
Why is it important to schedule a blood lead level test, and how do you do it?
Okay, thank you. Great question. So the only way you can truly tell if your child or yourself have lead in your blood, or his or her blood, is to get a blood test. There's some people who just act normal. You don't know. There are no outward signs necessarily. So you just go to your doctor, your clinic, your healthcare provider, whomever it may be, and ask for a blood lead test. Very simple. And what age is important to do this? Any age, but like I said earlier, particularly those ages 6 and younger, because their nervous systems and their brains are still developing. And they're much more sensitive to lead exposure than those who are older and adults. So if you should have positive blood lead test, what do? Well, Matt and I here in King County do home visits and trying to find the source of the lead exposure. So we have contact information for Matt and myself, I hope, somewhere. But you would just give us a call, or if we get the information sooner than the families might, we would contact the families, because that information pops up in the state database. And we would schedule a visit. And this time during COVID, we stay outside. It's a modified version of our pre-COVID visits. And that's what we would do, and just follow the family until their blood lead is within normal range or near zero. And we're always here to answer any questions. So back to you, Alex.
Excellent. Thank you, Sharon. We should be getting that contact info. We saw it pop up on the banner. We're putting it in the comment section as well. So we're heading towards our endpoint. We still got some time, but just to kind of recap what we've talked about so far, because we've had a lot of angles and perspectives on this, but our key messaging we want folks to take home is that lead exposure is absolutely a significant health hazard for everyone of all ages, but especially for children. And in Washington State, lead-based paint and dust are the top sources of lead poisoning. Now, for adults, occupation is that #1 source of exposure. Lead exposure is specifically harmful for kids because it impacts their developing brain and their ability to learn, things we want working very well. Lead poisoning is absolutely preventable. So there are so many steps you can take to protect yourself, protect your family. And two of the most important is to see when your home was built. And you can walk through that link that Matt showed us. And if it was built before 1978, damp, dust, and mop at least once a week. And absolutely, this is really good advice for anyone in any situation. Get your child's blood lead level tested. And Sharon, thank you for walking us through how to do that. So we're going to wrap up pretty soon, but I'm going to bring Matt back. Here we are. Matt, what are some resources on how to get help if you suspect lead poisoning outside of contacting you and Sharon directly?
Yeah, so there are a lot of really helpful resources online from our own lead program in King County. Also, the Washington State Department of Health also has some really great information from just the basics of lead all the way down to resources if you happen to live in a home that's pre-1978 and are interested in perhaps doing remediation work. There are links to connect you with certified renovation contractors to do that work safely for not only themselves, but of course for you and your family. Along with that, again, it's our program, Sharon and I, what we can provide with those home visits. So we are happy to answer any questions, take any calls, and respond to any emails that where someone has concerns when it comes to their potential lead exposure. And I just have to bring up the point again, which has been reemphasized, is that blood testing is going to be absolutely your #1 way of, if you're concerned about lead, get blood tested. And, find out if you have elevated levels or at least any exposure at all, and that will help determine, if this is something that you should do some further research to, and reach out to any of us.
Wonderful. Thank you again for that. Now we're sort of at our wrap-up point. We're getting close to our wrap-up point, I should say. We can hang out for another few minutes just to see if folks shoot any questions our way. If not, no problem. You can ask them after the fact. We can always end the stream a couple minutes early and each get 2 more minutes of our afternoon. Let's see. Oh, I did want to mention, we mentioned the poison helpline. That's always a good thing to remember. We also have the hazardous waste helpline, which is also a useful resource to have in your tool belt. We got so many tools to talk about today. There's that hazardous waste helpline right there. So good action steps for everyone is to take these numbers, put them in your phone, hang them on your fridge, tattoo them on your arm, whatever you need to remember them. I'm not let's see. I'm just going to take a glance at the comment section. Not seeing anything there. I will just leave it open to you all. Are there any last thoughts you'd like to share with anyone who's viewing at home? Let's start with you, Stephanie. Oh, and you're muted. Sorry about that.
No worries. So the main thing is just to be aware and to reach out to any of the resources, because we all work together, crossing each other's paths. So reaching out to one, we can get you in touch with another one should that be the most appropriate place.
Fantastic. Any of our hazardous waste folks? Let's start with you, Sharon. Is there anything you'd like to echo?
Although lead dust and lead paint are the most common sources of lead exposure, there are other sources as well, such as cookware, aluminum-containing cookware from overseas, sometimes spices the families have brought into this country, cosmetics from overseas, special ceramic pots or dishes from overseas as well. So if you have any of those or use any of those, again, it might be a good idea to get your children's blood lead tested.
Excellent point. The different countries have very different regulations and policies around lead testing. Thank you for mentioning that. All right, Matt, how about you?
Boy, Sharon really covered everything that I was about to say. So I've got nothing. Just happy to have been here today with all of you, and to all our viewers today. Very grateful.
Excellent. Good thunder stealing on the part of Sharon. And Julia, how about you?
I think the one thing I would say is, although this does seem to be a scary issue, and it is actually very concerning, I do want to refer back to Sharon's story where the child had a high level of elevated, it was lead poisoned, but that the actions that the family took really did reduce that child's exposure, and then their blood lead levels dropped. So although it's scary, it's definitely worth taking action. And getting your child tested is the #1 thing to do if you have any kind of concerns.
Absolutely. Well, thank you all so much for joining. Thank you for everyone who's viewing and for those who watch the future recording. If you don't already, I encourage you to follow us all on whatever social media you're using. I think we cover quite a few of them between the two organizations here. And we very much hope that this is a continuing relationship between the Washington Poison Center and the Hazardous Waste Management Program. So stay tuned for other collaborations on other topics. And that brings us to 2:29. I think this is an okay place to end. Thank you all so much and have a fantastic afternoon. Take care.
Thank you. Bye.